Hello, everyone. Welcome to Gift of Health Weekly Wellness Chat. I'm Dr. Arjun Rayapudi, and this is my lovely wife, Dr. Shobha Rayapudi. We're both lifestyle medicine doctors and co-founders of Gift of Health. At Gift of Health, we are helping people to get off medication treadmill, reverse chronic disease, lose weight, and keep it off, have more energy with food and lifestyle as medicine. Every week, we are bringing you uh, guests like these are experts in field of lifestyle medicine. And today we are super excited to have one of our heroes and the legend, Dr. Michael Klaper.
Yes. And Dr. Klaper doesn't need much introduction, but for those of you who are meeting him for the first time, like Dr. Klaper, like he is a gifted clinician and also an internationally recognized teacher. But the most like what I love about him is the way he describes about health uh, and the way he tells like how important it is like according to him, he says that health is having a body that moves without pain, breathes without distress, and allows us to perform the activities of life with complete presence and focused energy. And that's what we want. And Dr. Klaper, he has served as a director of the Institute of Nutrition, Education, and Research, where he conducted a study that focused on people who ate a completely plant-based or a vegan diet. And he has also practiced acute care in New Zealand and also served on staff of TrueNorth Health Center. And many of you may be familiar with TrueNorth Health Center, which is actually North America's premier nutritionally based medical clinic that specializes in fasting and health improvement. So he's also a member of American College of Lifestyle Medicine. So, and I know today, like we can just go on and on about him, and but as we said, like we are so excited to have him, and like and also like listen, because he has so much experience. I would say is just like a lifetime of experience.
Yes, this is a pinch me moment for us because hey, when we started our lifestyle journey, this is one doctor that who we looked up to, and we still uh, adore the work and the dedication that you have shown. It's not just over one decade, over several decades. So, Dr. Clapper, thank you so much for taking time and being with us here. Welcome to Gift of Health Wellness Chat.
Oh, thank you so much. What an honor it is to be with you. What a delight it is. And what a validation it is of the power, the truth of lifestyle medicine that an old primary care doc like me found my way to this very wonderful and effective way to get people healthier. And you in the far-flung reaches of Eastern Canada have this glorious program focused in exactly the same way. People's diet and lifestyle, when made healthy, gets the people healthy. And it's really the highest form of healing. And it says so much for our profession and so much for you two to have the courage and the vision to do this. And so the fact that we're meeting on this platform today is a gift. And for all the problems with modern technology, here's one place where it's doing such beautiful work and helping people to learn and to heal. So it is really a delight. I've been so looking forward to this connection with you. And for the viewers, as I mentioned, I'm for the first 10 years of my medical career, I practiced blood and guts medicine in emergency rooms, urgent care centers. But I began to see, my patients weren't getting healthier until I finally left general practice in dismay and despair and went into anesthesia, decided to become an anesthesiologist. And after a couple of years on the cardiovascular anesthesia service, dealing with people's hearts and blood vessels, every day I'm putting people to sleep and watching surgeons open their chests and open their coronary arteries and remove this yellow gunk from their arteries called atherosclerosis, which is largely the fat of the animals these people were eating. And my father died of clogged arteries. I knew if I kept eating the same diet he did, I was going to be laying on that operating table with that striker cell going up my sternum, and I sure did want that. So I changed my diet to a plant-based diet in 1981. And my body loved it. A 10 kilogram spare tire of fat melted off my waist in 12 weeks. My high blood pressure went to normal. My high cholesterol went to normal. And at that point, I felt great waking up in a nice lean body every day. And at that point, I realized I didn't want to be an anesthesiologist and spend my career putting people to sleep. I'd rather go back to general practice and help them wake up. And so I did. And much to my parents' dismay, as I left my anesthesia residency with 6 months left to go. And I went back to general practice, found someone to help me give plant-based cooking lessons. And my patients who made that plant-based transition experienced the same wonderful changes. The weight melted off, the joints stopped hurting, the high blood pressure comes down, the asthmatic lungs stop wheezing so much, the migraine headaches get better, the psoriasis skin clears up, the colitis bowels settle down, and they turn into normal, healthy people right before your eyes. It's the highest form of medicine. When I lecture the young medical students, I said, what greater gift could you want for your patients? To help them get the gift of health. How appropriate. You and I, all of us know that resonates with us on such a deep level because there's no greater gift. If you don't have your health, no matter how much money you have in the bank, you do not have wealth, that's for sure. But it allows you to enjoy the sweetness of life, the love and glory of this life. And if we can help our patients do that, it's the highest gift of all, and we're blessed to be able to participate with that. So I could wax for hours over this, but the main message that, especially to the clinicians out there, is that what just gobsmacked me as I got into lifestyle medicine is the reversibility of these fearsome degenerative diseases. When I went to medical school, a patient with clogged arteries, they're all going to need stents. They're all going to need bypasses. That's right, doctor. If you don't talk to them about what they're eating, that's what they're going to need. But this is a reversible disease. A whole food plant-based diet will melt these plaques out of the artery walls and turn them into healthy people. But again, the type 2 diabetes, the high blood pressure, I remember the formidable phrase when I read in Robbins' pathology book, medical school, these diseases are relentlessly progressive. Nothing stops these. Diabetes just gets worse, clogged arteries gets worse, lupus, they all get worse. Yeah, if you don't talk to them about what they're eating, that's what you see. But the glory and what every lifestyle doctor knows is that the healthy diet and lifestyle unleashes the body's healing powers. And these diseases recede. The body doesn't want to be inflamed. It doesn't want to have clogged arteries. It wants to go back to that state of health. And a whole food plant-based diet and lots of good lifestyle practices, enough sleep, enough exercise, a lot of laughter, get enough love in your life. And it's the magic ingredients that make for a transformation to a healthy body. And so I will, after this program, I will return to the electronic ether there. But I just want to tell you folks, you've got these two jewels of physicians in your community. Please take advantage of the wonderful teaching that they offer and work with them to get yourself healthy so you can know them as friends and not as your doctor on the operating table. So with that, I'll turn it back to you. And if we have questions, I'll be more than happy to entertain them.
Wonderful. So, Dr. Klaper, you summarized it so well, the lifestyle medicine, so well put. To our viewers, like today, first of all, share this with your friends and family. Hey, click that like button, love button, and share and invite your friends and family. This is we're talking about very, very important topic. Dr. Klaper is an expert in helping people to use therapeutic fasting, and we chose the we've talked on the wellness chat. We have talked about many health topics before, but fasting is something not many physicians are even not many physicians and general public people have so many misconceptions about fasting. So let's bust some myths through fasting. You type in if you have any questions about fasting or overall lifestyle medicine as well. So you want to get started? Yeah. So Dr. Klaper, there are so many misconceptions. Like many people think, oh, when I fast, does it slow down my metabolism, or do I lose muscle?
Or is it safe to fast?
Absolutely. Those are all common questions and not inappropriate. People would want to know about these things. It turns out the body is superbly adapted to brief periods, a few days, a week or so, of living on water only. When you think that sounds very radical, but if you believe in evolution at all, and you turn the clock back 1,000,000 years ago on the African savannas, our ancient foraging ancestors who spent all day looking for roots and tubers and edible fruits and grasses, etc. You can imagine that there was many times that 4 or 5 days would go by before you found that next berry bush with fruit on it, or the next carcass rotting in the sun, or wherever your next calories are coming from. And during those 4 or 5 days, if you're lucky you had water, you just had to power through it. And I think this played out millions of times over the years. It imprinted into our physiology, and our body is now capable, when we stop eating carbohydrates, and we are carbohydrate burning organisms. Our mitochondria burn sugars. I'm not anti-carb or anything like that. You need carbohydrates in their whole form, whole grains, whole legumes, whole starchy vegetables, etc. That's our proper fuel. But when you stop eating that for 24, 48 hours, certainly 72 hours, the body shifts metabolic gears, and you start living off the stored fat that's in your abdomen and under your skin. And the breakdown products, the ketones from those fats, sends all sorts of chemical messages to the body, and the body shifts into this remarkable gear of preservation. Enzymes get enabled that repair cells, that repair tissues. The stem cells that are normally rapidly divided, they kind of hunker down and say, I'll wait till there's more energy available. And so these fragile stem cells go into a state of protection and stability, which comes in handy during cancer chemotherapy. We can talk about that. The body cells look around for molecules that are stored in the cells that aren't doing any good, old starches and fragments of old proteins. Well, we're short of energy. Let's throw that in the metabolic furnace there. And so these cells start cleaning themselves out from these scrap molecules. The process is called autophagy. And the cells wind up cleaner. And all the time, water is washing through your cells. We say it's like taking your cells to the car wash. And so on a metabolic level, after 3, 4, 5 days of water, even an overnight fast, the cells are starting to heal, starting to get cleaner. The metabolism rebalances, and that if there's inflammation going on, inflammation subsides. Cancer growth slows down or stops. It's really a remarkable state. And people say, well, I don't want to be hungry for a week. it turns out, again, our body comes to the rescue. After 48 hours or so, after the first 2 days, hunger pretty much gone. You don't feel hungry anymore. God's gift to fasters. You don't spend a week hungry. And in fact, all the energy that would normally go into digesting your food on a fast, because there's no food to digest, that energy is freed up. And people feel it. At our fasting center in California, people would stop me in the courtyard. Doc, I haven't felt this good in years. I haven't eaten in 2 weeks. I feel wonderful. It's really remarkable. It's counterintuitive. You think you're going to be weak and tired and cold and shivering on the bed. And the truth is, people feel light and energetic. It's a remarkable state. And as I said, during this time, good things are happening. So, and we take advantage, high blood pressure starts to come down on a water fast. As I mentioned, inflamed joints from rheumatoid arthritis and lupus and psoriasis, the inflammation subsides. And as I said, the body doesn't like to feed cancers when calories are in short supply. So, so cancer growth dials way down. And as I mentioned, because the healthy cells, the stem cells in your bone marrow, in your skin, and other places, when they get this message that fasting is happening, those stem cells kind of hunker down and to protect themselves. They load up on antioxidants. They gear up their tissue repairs. Well, cancer cells can't do this. They're just macabre, dividing cells that don't pay any attention to signals like ketones. And so they increase their protein metabolism. They just go wild during this time. And that makes them much more susceptible to chemotherapy. And so I've been telling my patients, like ladies with breast cancer and people with leukemias, if you're going to go in for a round of chemotherapy, it works much better if you go in on day 2 or day 3 of a water fast. You'll get a much greater bang for the buck. It will potentiate the action of the chemotherapy. Plus, you get much fewer side effects, the nausea, the vomiting, the lightheadedness, much better if you go in fasting. And again, just 48 hours. I'm not talking about a 2-week fast here. Just 48. Don't say anything to the oncologist. Just do it. Just go in on day 2 of a water fast, and the chemo will work better, and you'll feel better. So fasting, it turned out this ancient therapy has all sorts of modern applications, and anyone can do this. There's various variations. When you go to bed at night, you're fasting. That's why the first meal of the morning is called break fast, because you're breaking the fast. Doing an overnight fast, these metabolic gears are starting to turn as you start tiptoeing into the fasting state. And we're finding now is when you get up, if you're really hungry, have some breakfast. But if you're not really hungry, and many or most people aren't really hungry, this first thing when they get up, we say, listen to your body. It doesn't need food right now. Just drink water till you get thirsty, till you get hungry. And if that goes all the way till noon, if you extend that nighttime fast all the way till noon, well, let's see, if you stopped eating at 6 o'clock the evening before, you went to 6 in the morning, that's 12 hours of fasting. And if you extend it up to noontime before you start your eating day, that's another 6 hours. That's 18 hours of fasting that you can do on a daily basis. And many people do. It's called time restricted feeding, or TRF. And it's a lovely thing to do, especially in our society where we're always eating. And to restrict your eating to a 6-hour window from noon to 6 in the evening. That's when they have your salads and your soups and your veggies and all the wonderful curries and other dishes. But after 6 or 7 in the evening, be done with food. You shouldn't be eating lots of food late at night for all sorts of reasons, but it messes up that wonderful series of events that I mentioned. So that's one way that you can get the advantages of fasting. Another is I've got patients who just do a brief fast on the weekend, every other weekend, from Friday to Monday. They'll just drink vegetable broth or just drink water. And it's a lovely, light way to get fasting into your life without disrupting your whole schedule. But if you've got a serious disease, if you've got a malignancy, you've got runaway high blood pressure, you've got runaway lupus that's really causing distress in your body, you may benefit from a much longer fast, 2 or 3 week fast. And for that, you need to be at a center like TrueNorth Health Center in California, where experienced doctors can watch over you and make sure that that all is going well there. So that's a whole other dimension of fasting. But what I mentioned before, the time restricted feeding, or there's other short intermittent fast, those are available to everyone. The only folks who shouldn't do it are people with type 1 diabetes, pregnant women, kids, or if you're on medicines, you can't stop. You need to stop your medicines during a fast. They get potentiated.
So I'm glad you mentioned that, Dr. Klaper, because like people are having questions. So can I do fasting if I am type 2 diabetic, or can I do fasting if I have any chronic conditions like hypertension, or like, is it okay? So what are the situations I can fast, and what are the conditions in which I cannot fast?
Right, absolutely. Important questions. Type 2 diabetes, where the person's still making plenty of insulin, absolutely. You can just cut the medications in half, but it's best just to stop them. And the worst thing happens, your blood sugar goes up, but it comes down. It's not a terrible thing. If you're just for 72 hours, you can do without, if you're type 2 diabetic, you can do without the metformin or the insulin, and give your body a chance to clear out your insulin receptors, and you'll find you'll have better control of your diabetes after a 3 or 4 day water fast. The high blood pressure, absolutely, but you want to take it easy. Don't go out and chop wood and be real active there. You want to let that pressure come down. You can, and again, you need to tell your doctor that you're going to be doing this. Don't if you're on potent medicines for blood pressure, etc., let your doctor know you're going to be checking your blood pressure a couple times a day. You're going to be sitting home, taking it easy. You don't have to lay in bed, but to catch up on your reading or your video games that weekend. And a 3-day fast off of blood pressure medications shouldn't put you at any risk, and may well lower that pressure, so you'll need less medications when you come back. And with all these things, the important thing, as we stress again and again, the fast is very nice, but what really matters is what you eat after the fast.
Yes, you could be fasting or doing a wonderful weekend fast or doing time restrict feeding, but when you sit down to eat, you're eating all processed food and butter and cheese and meats, then you're still increasing the inflammation, and
it's shocking how quickly Cinderella turns back into a pumpkin there. The blood pressure goes up, the diabetes gets worse, the joints start hurting. The fast should be the stepping off place to a whole food, plant-based diet. This is a beautiful time to break the fast with vegetable broth or vegetable soups, and maybe with some watermelon chunks, and then get into your nice stews and soups and curries and plant-based entrees. But the important thing is the plant-based, the low-fat, low-salt, low-oil, plant-based diet that you eat after the fast. That's where the focus should be.
Yeah, absolutely.
So one question we got is, will fasting change or affect our gut microbiome?
This is actually from Dr. Potluri. She's Sirisha Potluri. She's one of the docs who's teaching a lot of people, like thousands of people, how to use food as medicine. And she creates wonderful, delicious recipes. So her blog is Plant-Based Los Angeles, right? So Dr. Klaper, you might want to check the Plant-Based Los Angeles, especially like if you have anyone who's looking for tasty Indian recipes. Like Dr. Potluri's Plant-Based Los Angeles. So she's asking this question: will fasting change the gut microbiome?
The answer is most assuredly yes. Of course it does. On some level, the more we're learning about the microbiome, how could it not change? Everything we eat changes the microbes that live in our gut. The analogy, the image I use is that the food stream that we're putting down our intestines is like the conductor at a symphony orchestra who brings up the woodwinds and turns down the brass. If you eat lots of sugar, you summon up sugar-eating microbes. If you eat meat, you're going to summon up carnitine-eating microbes. The food we eat determines the microbes we live in our gut. Well, when you go on a water fast, suddenly that stream of sugars and proteins and fats from the food, gone. And that's certainly going to change the balance. We're just starting to actually quantitate to see which microbes go in ascendancy and which are depressed. It's as you might expect in general, it's the more beneficial microbes, the Prevotella species that are anti-inflammatory and suppress cancer growth. They increase on a water fast. Where some of the more pathogenic ones, the Bacteroides and the Clostridia, they decrease on a fast. So absolutely, but I've been exhorting my colleagues back at TrueNorth Health Center. I still do rounds by telemedicine once a week with them. And I say, listen, you guys are in a great position of bringing your healthy patients who are coming in just for a tune-up fast, but don't have any serious medical problems or not taking medications. But if they come in for a 2-week clean out fast or a 3-week tune-up fast, every other day, get a little stool specimen and send it off the lab and see and document exactly what changes are happening over these long fasts. But the studies I've seen over the short fast, over the longest one I've seen is 7 days. Absolutely, the microbiome changes towards the beneficial species. But if you go back to the meat and the cheese, well, guess who comes right back? In other words, they don't get summoned out of the ether. The good bacteria, they're already down there in your colon. The bad bacteria, the pathogen, they're already down there in your colon. It's just a matter of, are they going to grow or are they going to recede? And that's determined largely by the food we eat.
Yeah. So how long can a person safely fast without doctor supervision if they're trying to do at home? So
if you are a basically healthy person, you're not on medications and you don't have type 1 diabetes or anything like that, the outside limit that we're all kind of agreeing on is the most would be a 5-day water fast at home. But even that, you gradually build up to, there's no hurry here, there's no emergency. Start with a 1-day fast and get through that to prove yourself that, yes, I can go 1 day without food. And then, say a couple of weeks later, do a 2-day fast, do Saturday and Sunday, say. And convince yourself, yeah, I can do that. And my pulse didn't go crazy. I didn't get lightheaded, no nausea. Okay, I can do a 2-day fast. And then in a month or two, try a 3-day fast and slowly, wade into the water there, so to speak, and until you can safely do a 4 and at the most a 5-day fast. You don't, if you have to do more than that, you should be where there's supervision, but healthy people can fast up to 5 days on their own.
yeah.
So to the viewers, I just want to share my personal experience with this doing at home. I was someone who was used to eating many times. Like I was on before I started plant-based eating, I was on a seafood diet. I would see the food and eat it. So, but after plant-based, even when I changed to plant-based eating, I was still on a seafood diet. You just see, as long as it's plant-based eat. So, but from that, became more conscious, and then I started exploring. Like once I started doing more yoga and meditation, I found that my need for gorging on food actually came down, and went from eating 4 or 5 times a day to 2 times a day, and did that for about 40 days, just 2 times a day, 10 or 11 o'clock in the morning, 5 or 6 o'clock in the evening. So that was an experiment, did a 40-day experiment, and felt great actually. Less food, less dishes to watch, and more time, but full of energy. And then after that, did a 40-day experiment of just eating once a day. That I thought that was a little bit difficult, but it was okay. Then I read more upon this benefits of water fasting, because it's not something we learn about this in medical school, right? We had so many topics, but never ever had a subject called fasting. So I had to, and I'm learning all these benefits of fasting, like when I was reading the journals, but how can I recommend it to someone without experimenting it on myself? So I was like, okay, it's time to do that. So I did a 1-day water fast. It was like a revelation. I could last all day long with just water for 1 day. It was like a breakthrough moment. Then, okay, let's do 2 days. So I did, okay, 1 weekend. So didn't do much, didn't put any activity much. Okay, just let's rest. So did a 2-day fasting. That worked okay. So then I built up to like 3 days, 5 days, and then I did a 10-day water fast. And that was like quite learned so much about how we can regulate our energy. As you shared, Dr. Klaper, like first 2 days is a little bit challenging, but day 3 is when the body shifts from metabolizing glycogen to breaking down the fats. Like after third day, I rarely felt any hunger. But to the viewers, I just want to share, as what Dr. Klaper was sharing, it is something that you built gradually, like, because most, I mean, as a culture, we are used to gorging on food, feasting, not fasting. But so when you when you hear the word fasting, people will roll their eyes. No, it's not for me. But this is something that you gradually build. Like, if you're eating 3 times a day, may go to what Dr. Klaper was saying,
2 times.
2 times, yeah. And for the most part, like we eat 2 times, and that's pretty good. This can be done. This can be done at home, but I wouldn't recommend 10 days by yourself at home, because I mean, we are physicians ourselves. We know what to watch for, what to look for. But anyone who's doing this on own at home, as Dr. Klaper suggested, start with 1 day, 2 days, and maximum 5 days. And yeah.
Yeah. And
If anyone would like some guidance, especially people who live in Canada, I work for an organization called Plant-Based Telehealth, and if you would like, I'll be glad to supervise a 5-day fast for any of your viewers there, and we can do it long distance if they're basically healthy. And I'll check in once a day and see how they're doing, and that's certainly a good way to get introduced with a little bit of supervision as well. So there's help available. And again, there's no hurry to to crash right into these things. Just tiptoe into the water, and you'll get there. If you would like something a little bit more tasty, you can make or buy vegetable broth these days, and you can buy boxes of it at the store. And low sodium vegetable broth, and it's rich in potassium, but there's no calories in it, and it's pleasant on the tongue there. So you can sip vegetable broth. Or you can take water with just a couple drops of lemon juice in there. Some folks do that. You can also use sparkling water, as long as it's clear carbonated water, that works as well. So there's ways you can work with the liquid you're drinking to make it even more pleasant.
Excellent, because that exactly, like, we also had a question about that. What type of fast would you suggest? The question was, what type of fast would you suggest for a 50-year-old woman? What should your first meal be when breaking a fast?
If it is less than, if it's 5 days or less, it's safe to use melon chunks. If it's in season, you can get it to cube up some watermelon and a couple of chunks that's just ambrosial. If you haven't eaten for 5 days, a watermelon chunk is delicious. Some watermelon juice or any type of light dilute fruit juice works. We use watermelon celery juice combined. But when you break the fast, you don't just chug a lug a big 16-ounce glass of juice and throw it down your throat there. You take a mouthful, put the glass down, chew it up, mix with your saliva, swallow it, wait 10 minutes. Let it get down into your system, let it get down into your stomach a bit and start getting absorbed. And then another mouthful, put the glass down, chew it up, swallow it, wait 10, 15 minutes. Take an hour or two to go work your way through that glass, just sip it. So that's one way to break it with melon chunks or juice. There are people that they don't want anything sweet. It's not appetizing to them. So a glass of, again, this good old vegetable broth, get a little potassium in your system there. And then you can go into a, if you get a yellow summer squash and cube it up and steam it, steamed squash chunks work very nice. You can make a broth-based soup. It's basically vegetable broth with some kale leaves and celery chunks floating in there. Nothing much in there as far as calories go, but it starts getting that chemical message going to your system. This, all right, start the engines, food is coming again, and while supplying lots of good electrolytes, etc. So use either, as I said, fruit juice, melon chunks, steamed squash chunks, or a broth-based vegetable soup, and do that just for the first solid day. After the fast, just do the melon chunks or the juice or the broth or the soup, and get through that whole first day just on that very light, high water content fare. And then if you're really hungry the next day, you can move on to some steamed vegetables that are well steamed. And then by day 3, you pretty much get back into grains and starches at that point.
Dr. Klaper, thanks for that. Your screen is a little bit fuzzy right now. Like, is it has to do with the webcam or?
My camera, it will refocus. I got out of the focal length there.
Yeah.
It will sharpen up in a minute when it's convinced that actually I really am this blurry. Actually, when I didn't. No, I'm joking. But it does.
It should probably refocus, huh?
Yeah, it'll sharpen up in a minute when I.
Okay, yeah. So we'll continue. Yeah, we can still.
I moved too far out of the focal length.
Okay.
Sorry about that. It'll sharpen up.
There are other question is, do you recommend normal exercising during fasting?
Oh, that's an important question. No, fasting is a time for rest. The reason why is that if you're just burning fats for energy, glucose levels can fall and to a nice low level, which is okay. But if you then go out for a 3K run and those big quadriceps muscles start pumping away, they will burn your blood sugar way down. And you can get a serious hypoglycemic reaction. Your blood sugar can fall too low. So during a fast, it's a time of easy movement. Stretching is wonderful. Yoga is beautiful during a fast. But that's about it. Just some stretching, some yoga, easy does it there, but nothing aerobic, nothing to work up a sweat. Plenty of time for that after the fast. No, gentle movement only, nothing aerobic during a fast.
Okay, and we have a question. Should I detox before fasting, and how to do that?
Oh, interesting question. Am I back in focus again for
Yeah, perfect.
Yeah,
It's
okay,
perfect.
great.
Yeah,
Right.
crystal clear.
Yes.
Okay, good. I feel more focused. Good. The question about detoxing is interesting. In a way, of course, the fast is the detox. I mean, that's why you're doing it. And believe me, people detox. We frequently see, especially during the early days of the fast, days 3, 4 of the fast, the body uses every avenue it can to get rid of the toxins that build up in our body from processed foods and restaurant meals, etc. And we see everything at our fasting clinic. People get nauseated, some vomit, some their breath changes. We see skin rashes. We get some loose stools. People urinate more frequently. The body just really uses every avenue it can to cast off these molecules that accumulate during modern life. But by day 4 or 5, that's pretty much done. And so that's why these longer fasts of the 8-10 day fasts leave you really nice and squeaky clean on the inside there because of that detox during the early stages. If you're doing shorter fast, that's why I say these repetitive fast. Once a month, if you do a 3-day fast, you'll move towards getting lowering your toxin load there. And again, when I talk about toxins, these are metabolic toxins from just metabolism of proteins and fats, but also, in our fat tissue, we all have remnant molecules of every restaurant meal we ever ate. There are artificial colorings and flavorings, and preservatives and stabilizers and dough conditioners and yellow number 3 dye and all those molecules that are part of modern cuisine. They're in our tissues, and they don't do good things for our cellular metabolism. And a fast, like we said, it's like taking your cells to a car wash and they'll flush that out. So the fast does it. The intermittent water fasting is a good way to do it. But I think behind your questions, he's asking, before I do a fast, do I need to do enemas? Do I need to do high temperature saunas? Do I need to do things? We would often, if someone came into our clinic and they've just been eating meat and cheese and white bread, and we can feel when we palpate their abdomen, we can feel the lumps of hard stool in their colon. Boy, you don't want that sitting there for 5 days. It gets harder and drier. So those folks would do well with an enema, or we send them over to the colon therapist and get them flushed out. So if your diet is pretty standard Canadian, if you're full of white bread and cheese and meat fragments, an enema often can be helpful before you start the fast. Once you start the fast, don't be doing enemas or hot showers or anything like that. It drops your blood pressure. People get lightheaded. Not a safe thing to do. But before you start the fast, an enema, or if you're a sauna fan, yes, you can do saunas. Other than that, wait till afterwards. Same thing with the massages. They're best done at the beginning of the fast or after the fast. They can tend to stir things up. We've had people get a little lightheaded and nauseated after a massage during a fast. But again, those are the longer fasts. If you're just doing a little 3-dayer, if you want to get a massage in the middle of it, that's probably okay. So the detoxing, the best thing is don't put the garbage in the first place. If you're,
you don't have to detox if you don't have to detox if you don't put the toxins.
Exactly. No one really needs to fast, really. If all you're eating is beans and greens and fruits and vegetables, you're not going to have all this toxic residue to deal with. But if you're all loaded up there, then yes, might be a good idea to clean your colon out before you start the fast.
Wonderful.
So we have another question saying, how about hypothyroidism? Can it be reversed with water fasting?
Oh my, I wish I could say, oh, absolutely, works like a charm. Just wear 2 cloves of garlic around your neck and eat a rutabaga and it goes away. Alas, there's a few conditions that are just so stubborn and recalcitrant. And as far as I know, water fasting per se will not reverse hypothyroidism. I didn't know anything that could until I ran into a piece by Dr. Michael Greger on his nutritionfacts.org. Most people have hypothyroidism due to an autoimmune condition called Hashimoto's thyroiditis. And I had no idea how to treat this condition. It seemed to be beyond treatment. Apparently, according to Dr. Greger, this wonderful spice called black cumin apparently has some alkaloids in there that get into your thyroid and really help it start working better. So if you've got hypothyroidism, and especially if it's the Hashimoto's variety, do a Google search on black cumin and hypothyroidism and see and just a little bit, half a teaspoon a day.
And it's tasty as well.
And it's tasty. The worst side effect, your food tastes better. So that offers more hope than the water fasting, actually.
There is another question here, Dr. Klaper. So does fasting result in affecting the thyroid function? Like, how does it affect the thyroid function? How does it affect the testosterone levels?
Very interesting. And again, this has to do with the length of the fast. if you're doing just 3 days on water, don't worry about it. There'll be just essentially no real changes in hormone levels or thyroid function, etc. The longer fast, you're doing these 7-10 day fasts. Again, the body, uh-oh, what's up? No calories are coming in. Boy, I better minimize, and I only have a set amount of calories stored on me. I better use them very carefully. And one thing the body does by about day 7 or 10, if you're doing a long supervised fast, is that indeed thyroid function dials down a bit. And again, they slow down the metabolic furnace there. So you're losing less calories and heat, etc. So yes, but it's a transient thing. But yes, it's not exquisite. The body knows to do that. But yes, it turns down thyroid function a little bit, but it's minor and it comes right back. A question about muscle mass. Some people are, oh, I can't fast. I'm going to use muscle. I'm skinny already. I don't want to lose any muscle. It turns out that if you're doing up to a 5-day fast, you will lose on a 5-day, you'll lose 2, 3, 4 pounds, well, 4 pounds. But it turns out it's not muscle. The total amount of muscle is about 10 grams, the weight of about 4 pennies. Most of that weight is water out of the tissues. Water is heavy. And glycogen, the stored sugar in the muscles, you burn that down, and that weighs something. And so most of the weight loss is water and glycogen out of the muscles. Well, as soon as you start eating and drinking again, it comes right back. And so don't worry, I'm going to lose all this muscle. You're not. And even the folks who do these long fasts, these 20-day fasts, muscle protein is burned over to about day 2 or 3, and then that evens out. The body's using the fats and ketones for energy. It's not having to use the muscle protein for energy. So very little muscle tissue is lost during even a long fast, and it comes right back as soon as you start eating protein and exercising again. It comes right back. So don't let the muscle mass loss be a deterrent for you if you want to experiment with fasting.
So you're not gonna, become emaciated with fasting. That's people worry, will I look like cachectic or emaciated? With fasting.
Right, and the converse of that is we would have people come to TrueNorth who were obese and say, "Oh, I want to do a 40-day fast. I want to lose 40 pounds of this fat and melt it right off there." And they inevitably leave disappointed. Why? Because after about day 5 or 10, as I mentioned, the metabolic rate slows down, the body gets much more efficient, and the actual amount of fat that's actually lost each day, because most of it's, as I said, water, glycogen, the actual amount of fat lost is maybe a half a pound, if that. So, even on the longest fast we would do is 40 days, and so they would lose at the most 20 pounds. But as soon as they start eating again, most of it comes right back in their tissues there. And gee, I did that long fast. I only lost 6 pounds, only lost 8 pounds. It's not about weight loss. Weight loss happens through your daily diet filled with fruits and vegetables and legumes and grains and whole plant foods. It's largely fiber and water. That's why people who eat this way are lean, because they're not eating all the meat and cheese and oils and sugars in the Western diet. They're filling their belly up with fiber and water, and you wind up lean on that. You can't hold excess weight on that. That's how you lose weight. It's not through a long water fast. A long water fast can be a jump start to a healthy diet, but it's the food. I've got my plaque on my office wall here.
It's the food. It's been the food all along.
Right. And so that's what the emphasis should be. Don't ask the fast to do things that it's really not designed to do.
That is so important, right? Because
Yes.
many people think fasting means weight loss, but you've said it beautifully. Okay, with fasting, you will lose weight, but as soon as and the weight loss is mostly from the water and the stored glucose, glycogen. And as soon as we eat, most of it will come back. right?
Yeah, yes.
That is important to know. But there are still so many benefits, and it's a great way to jumpstart, because many people, even on a plant-based eating, they feel like stuck, that they have hit a plateau, right? The weight is not moving. Maybe doing a 2-day, 3-day fast will just like really jumpstart, keep you get motivated. Okay, and let's get back on eating more, grains, beans, and fruits and vegetables.
Absolutely. Oh, Arjun, you said it so well in that because one thing, your taste changes. We load up all the restaurant food and even the vegan burgers and snack foods and all that stuff. You start looking, craving for that salt and sugar and fat. Well, after 3 days on water, 4 days on water, it clears your palate. Boy, a piece of mango tastes so magical. It's so beautiful.
Yeah.
Yeah, it really refines your taste. Yes. So
In fact, I did a recent 3-day water fast, a 3-day fast, and we went for a walk. And when we went for a walk, like we have this blueberry beds. The flowers are coming, and I just picked the flowers and ate them. They tasted so tasty. I'm like, these are so tasty, the blueberry flowers. We could start putting them in salads. It's like Shobha is like, you're just finishing a 3-day fast.
indeed, absolutely. And as you say, there's so many benefits. Fasting is about health. It's not about weight loss. It's about health. All your organ systems will work better after a fast. Your heart, your blood vessels, your endocrine organs, your kidneys, everything's going to work better. Your poor liver that we asked to detoxify all these things, your liver will be smiling if you take a picture of it, you'll see it's got a big smile on it there. But kidding aside, all the organs benefit from fast. We eat too much all the time. We're constantly, eating. It's so your body's looking for a break, and a fast is a nice way to do that.
Yeah, and I'm so glad, Dr. Klaper, you brought this point, because like a lot of people have this misconception to, okay, if I want to lose weight, I have to fast. So on that grounds, the other question they have is, which one is better, if I fast 1 day a week, or maybe I fast 2 or 3 days a month? Like, is there a difference, like if we do this
Right.
in all these different types of fast?
There probably is a difference, and I have to give you that weasel answer, probably. In the reality is that we're just at the early stages of looking at fasting seriously as a clinical tool, and we know so little about it. I mean, that is an important question, and that study should be done. They should take 500 people, and 250 of them do a once-a-week fast, say, and the other 250 of them do a 3-day fast once a month, and 6 months later, let's see how everybody's doing. How's their blood pressure? How's their cholesterol? How's their weight, etc. We really don't know. Again, anytime you spend in the fasting state, good things are happening in your body. So there's never a wasted fast. But I can't give you a solid answer. It really depends on your lifestyle. If you got kids at home, if you've got work obligations, travel, it's hard to fast when you're flying to. Well, I got friends that they deal with the airline food very effectively. Oh, I fast on those days when I'm I don't deal with the airport food. I do a water fast when I fly, and it's great. And they land less jet lagged. It's not a crazy thing. Yeah. But again, the world's very tempting out there. You're out with friends and you go to restaurants. It's not a convenient time to do a water fast. So do it when you can, when your life permits, and experiment and do both. For 6 months, do a 1-day fast weekly, and for another 6 months, do a 3-day fast once a month, and see how you feel. At the end, your body will tell you.
So I guess like you answered this question already. Like one person was asking, hey, would you recommend doing 1-day fast twice a week or 2-day fast once a week?
I would think you'd get more effect from the 2-day fast once a week. You really start getting into serious ketosis in 48 hours, and that's a good thing. Those metabolic gears are starting to turn, and you're really starting to clean out your cells. If you can put 2-day fast together, that's a more desirable, more potent way to run your fasting program.
Okay.
So, Dr. Klaper, we have a few more questions. I'm not sure, like, can we
Yes,
keep?
absolutely.
Okay,
Absolutely. We're on a roll. Good.
Yeah. So does the temperature of the water makes a difference if we are doing a water fast, if you are drinking warm water, or does it matter? The
It
temperature?
should be room temperature water. Ice water is not what you want to splash against the back of your throat. If the water is cold, hold a mouthful in your mouth and let it warm up a little bit. Hot water, well, you're going to sip that. There's no reason for it to be hot or cold or icy. Room temperature water, and within a few degrees of that, a little warm, a little cool is fine, but not real hot, not real cold.
So the other question we have is there a relationship between osteoporosis and intermittent fasting? Is there an increase in osteoporosis due to intermittent fasting?
I really don't think so. That's a profound and important question. And of course, as far as I know, there's been no studies. I mean, you need to take, 1,000 or 500 women, do a bone density study at the beginning, get them on an intermittent fasting program, once a week or time restricted feeding. And after 6 months, 12 months, 18 months, do another bone scan and see what's happened. Well, nobody's really, there's no money to be made in intermittent fasting. Nobody's really looked at that. But that said, it's not a negligible question. It's a real issue. So I'll invite people to go to my website, drklaper.com, doctorklaper.com, and click on my video called Healthy Bones. And I go through the mechanism behind osteoporosis there. And osteoporosis is largely disuse atrophy of our bones. We've stopped using our bones, and they're dissolving. Just like if you don't use your muscles, they get weak. They turn into guacamole. If you don't use your bones, they turn into styrofoam. We used to spend all day out being physical beings. We used to spend, 100 years ago, 200 years ago in Canada, we wouldn't be sitting in front of computers. We'd be out all day gathering firewood and working in the garden with heavy tools and carrying buckets of soil and loads of wood on our shoulder. And carrying weights against gravity strengthens your bones. They strengthen your muscles, strengthen your bone. That's the way to really reverse osteoporosis and prevent it, is to be physical. But we sit all day. We sit when we eat. We sit when we travel. We sit when we work. We sit when we answer our email. We sit. And as a result, our bones are dissolving on us. And that's what's really behind the osteoporosis phenomenon. And a poor diet with too much salt and acid and sugar in it, that contributes, but it's largely our inactivity that's driving it. So that said, getting back, would intermittent fasting make that worse? Well, you're not going to do a whole lot of physical activity during a fast. Though you could sit on your couch there and take a little 5-pound weight, and while you're watching TV or whatever, you certainly could do a little gentle exercise. Absolutely, there's nothing wrong with doing that. We would encourage that. But I can't imagine your bone density is going to suffer greatly by doing these intermittent fasts. So don't worry about that, but stay active, keep moving, keep using those bones. That's more important. But if you want to do intermittent fasting, go ahead, don't worry about your bones, they'll be fine.
Excellent.
How about steep tea? You okay with like using some tea while fasting?
Yes, that should be fine. Really, you don't put a bunch of milk and sugar in there. But yes, I'm I'm just finishing my hibiscus tea here, and yes, it's lovely to sip tea. And we don't want to stimulate your taste buds so much. So that would be the only. I'm thinking of what Dr. Goldhammer, the head of the fasting clinic, would say about tea, because we only use pure water there. And he'd say, well, you're getting the pleasure trap mechanisms going. They're going to want, after that tea, they're going to want something sugary or something salty. So that's and for the folks not familiar, there's a lovely book called The Pleasure Trap that explains a lot about why we keep putting salty, sugary, fatty things on our tongue here. And so one of the ways out of the pleasure trap is to do a water fast and break those associations. So he was saying it would be going counterproductive to that if you had to start using these tasty teas here. But in the real world, there's no calories in it, and it wouldn't metabolically adversely affect the fast. So if it would help you get through, I don't have great problems with it, but observe to see, make sure it doesn't increase your appetite for foods you shouldn't be eating.
Well said. So people are wondering, are there good recommendation for a resource to read on fasting?
Yes, there's some good ones out. Dr. Joel Fuhrman, Fuhrman, wrote a good book called Fasting and Eating for Health. So read Dr. Fuhrman's book. It's excellent. Go to the website of TrueNorth Health Center. The name of their website is healthpromoting.com, all one word, healthpromoting.com. That'll take you to or just Google TrueNorth Health Center. And their website has a lot of information on water fasting, and you can certainly start with that. Those would be the two best resources to use right now.
I couldn't agree more, Dr. Klaper. Like I use that book, Fasting and Eating for Health, like when I wanted to learn about and use it. So I just use that as a guide. Dr. Fuhrman summarized like so much.
Beautiful.
There's not good resource and to read about fasting, but I found that's the most comprehensive, and like the Dr. Fuhrman's Fasting and Eating for Health.
Really small one.
Yes, and easy read. And of course, TrueNorth Health Center website is amazing. What's your recommendation for someone who's suffering from rosacea, with or without fast?
Right. Rosacea can respond. I've been amazed at people when they would come in and do these long fasts. Some would come in with really gnarly plaque psoriasis, and in my medical office, week after week, I look at those plaques, and they're not changing a whole lot. I was gobsmacked supervising these fasts to watch these plaques of psoriasis. I know we're talking about rosacea, but to see these plaques of psoriasis fade right in front of my eyes by day 10, 12, 14. The plaques was hard to see where they were. I was stunned to see how quickly this nasty inflammatory skin disease responded to a water fast. You can only just imagine what's happening in that skin. The chemistry of the skin oils are changing. The microbes on the surface are changing. The lymphocytes and blood and immune cells in the skin are changing. And whatever all those changes did, the psoriasis got better. Well, seeing that clearly the skin as an organ responds to fasting. A patient came in with bad dry eczema, and by day 10, his eczema was much better. So skin does respond to fasting. Now rosacea is a strange, difficult condition. There's bacteria down the hair follicles that causes dramatic inflammatory swelling of the skin, and there might be completely natural Ayurvedic type of therapies for it, but as far as I know, you need to use some pharmaceutical agents, whether it's topical metronidazole gel, sometimes resist the oral antibiotics there, but there are topical gels to use, and we can imagine that the use of those gels would be much more effective combined with the water fast. So if you've got rosacea and the doctor's giving you a prescription for one of these gels, that would be a great weekend to do a 3-day fast as you're putting the gel on there, and see if you don't get a much better clearing from it. And talk about intermittent fasting, 1 day a week while you're doing your rosacea treatment. You did through a water fast day in there. I'll bet you get a better response because everything changes, the microbes in the skin and all that. So it's an adjunct fasting to standard rosacea treatment.
Excellent.
Yeah. So this one, this question is, it always comes up. So, so the benefits of low carb, high fat diet is similar to fasting. It looks like from the effects on endocrine system. So people are talking about low carb, high fat, like a ketogenic diet. So the benefits seem to be similar to that. So how does whole food, plant-based, no oil reconcile with low carb, high fat?
Right. The folks who are advocating the ketogenic diet, which is high in fat, low in carbohydrates, have stumbled into the same beneficial changes that we observe in water fasting. And they witnessed a decrease in inflammation and improvement in hormones, etc. And yay, that's very nice. But let me just say that the fasting state of burning fats and ketones for energy and the resulting changes that echo through the various systems of the body. This is a stress response. This is an emergency fuel response. The body has run out, there's no carbohydrates to eat. You're starting to eat yourself here. All sorts of different rules apply. And it's a state of stress. These ketones, the fragments of the fats that are being burned, these are acidic molecules. This is beta hydroxybutyric acid, acetoacetic acid, acetone. These are acidic molecules. This is a constant acid load for the body. Ketosis is a state of chronic acidosis for the body, low grade, but it's there. This can be hard on the liver, hard on the kidneys, hard on the bones. If you're in Buren there and you're out on the highway and there's a slow truck ahead of you, you pull out to the other lane and you hit the gas and vroom, passing gear, and your car hits that passing gear and vroom, you zip by the truck and you pull in and take your foot off the gas, yay, passing gear. It's a nice gear to have, but you don't want to drive to Toronto in passing gear. You'll burn out your engine. The same thing with ketosis. It's great for a week. It's great for a few days, 10 days, that's fine. And sometimes under supervision longer than that. But you don't stay in ketosis week after week, month after month. A ketogenic diet, if a little ketosis is good, more must be better. Not true. And I'm afraid these folks who stay in ketosis like this and adopt this dogma that has no real basis in science, well, that's what our caveman ancestors say. No, they didn't. The fact is that when they analyzed the fecal droppings of the Paleolithic folks, they were eating starches. Most of the calories brought into the Paleolithic camp were gathered by the women. Once again, the women got us through, and they spent all day foraging for these starchy roots and tubers that our small mouths and our flat grinding molar teeth are beautifully designed. We don't have fangs for tearing flesh. We are starchivores, we're starch-eating creatures. And it was the edible starchy roots and the berries and the nuts and the edible grasses. That's what got us through. We've been carbohydrate-eating creatures all along. Fats were a rarity in ancient times. They're outside the occasional coconut or dead carcass. There wasn't a lot of fat. Even the game animals were lean, gamey, muscular animals there. For them to say, oh, we were eating fats all the time, we're in ketosis all the time. No, we were not. We are carbohydrate burning creatures. So the idea of staying in ketosis month after month and thinking you're doing something good for your body, you're not. And I think these folks are going to wind up with more osteoporosis. They may wind up with decreased kidney function. It may increase malignancies of the GI tract, various lymphomas. This is not a healthy diet to do long term. You put your toe in the water for a day for fasting, 3 days, 5 days, and enough. So I'm not in favor of these long-term ketogenic diets that keep people in ketosis for many, many weeks. I think it's dangerous.
So well said, Dr. Klaper. I just want to add, like my one of the observation in my clinical experience with hey, how does whole food, plant-based, no oil eating reconcile with low carb, high fat diet? This person, like you may be looking at that ketogenic diet has similar effects similar to fasting. So it's maybe okay on the endocrine system, but it is not okay on the gut, right? The benefits, like my work is primarily doing gastroenterology and general surgery. Every week I see people with acid reflux, like, hey, new onset acid reflux. And I take history. Oh, I recently started eating more healthy. And I'm like, more healthy, tell me about it. Oh, I'm eating more eggs, I'm eating more chicken breast, I'm eating more cheese and butter, I'm avoiding potatoes. I'm okay. Oh, you're doing low carb high fat diet. That's why, because see, when you're eating a lot of animal protein, your stomach has to make more acid, hydrochloric acid, so that to digest that animal protein, you need to, the pepsin, the enzyme has to be in the active form. So the more animal protein, which basically in the low carb, high fat diet, you are eating more animal protein and also more fat, more animal fat. That means the stomach is slowing down because there is more release of cholecystokinin. So the stomach is slowing down. So you have a stomach bag full of acid, and that's not going anywhere. Especially when you lie down, it's going up north. So acid reflux. And many people, like I see people with like gallstone disease, like new onset gallstone disease, I'm having more recent flare-ups. Hey, what's going on? Recently I changed my diet, and
I went to ketogenic diet.
yes. So not, these are just, not just acid reflux and the gallstones. You have more risk of getting diverticulitis, constipation, irritable bowels, hemorrhoids. So your gut, from mouth to bum, you're just inflaming your putting your gut under stress. Also, you're stressing out on the pancreas. Like, pancreas is one organ which is heavily involved in digesting the animal protein and the fats. So you're overworking pancreas to break down those amino acids and fats. Your liver and kidneys also have to go on overdrive. So you may see similar, this is the reductionistic approach. Like, some people, when you're analyzing, looking at the microscope, oh, low carb high fat diet has similar effect like fasting, oh, it must be good. But it's not. Like, when you look at the body as a whole, it's you're damaging your gut. On the other hand, with the whole food plant-based eating, when you're eating so many plant-based foods, like lots of fiber and the phytochemicals and antioxidants, you're feeding the good gut bacteria, your microbiome is much more healthier. So we could go on, but summary, the gut loves more plant-based foods, and the animal-based foods are not the good idea for the gut.
Absolutely. As mentioned, and I tell folks, don't be seduced by these earlier changes. Yeah, your weight's going to go down if you stop eating breads and flour products and baked goods and oils. Well, I guess they eat oils. And blood sugars will go down because you're not eating any sugar, but they're all insulin resistant. They're all loaded up with fats and their insulin receptors. But as physicians, we have to ask, what are these people brewing up in their arteries? What are they brewing up in their colon walls? What are they brewing up in the vasculature in their brains? Are they setting themselves up for dementia, for colon cancer, for heart attacks, for stroke? Nobody's been on these ketogenic diets for 10 years, 20 years, 30 years. I predict, sadly, that they're going to learn the hard way, that we are not mountain lion, we're not cougars, we can't be eating their kind of diet. And I think they're setting themselves up for an epidemic of strokes and heart attacks, dementia and diabetes and colitis and Crohn's disease. It's not our diet, and I think the health ramifications are going to be very hard to take for many people, unfortunately.
So is there a concern that the pancreas alpha cells may constantly pump during fasting?
Pancreas functions, remarkable in many ways, how responsive that organ is. Now, you're talking about the alpha cells making enzymes, or the beta cells making insulin.
Alpha cells making the glucagon, right? Like
the glucagon. I'm sorry.
Yeah, so alpha cells. So basically, the person is saying, is that a concern that the pancreas alpha cells pump constantly during fasting? I don't see.
If they're putting out glucagon, it's a very modest amount. There's a little bit of sugar being produced to keep your red cells alive from gluconeogenesis, made from protein. the sugar in the muscles basically stays in the muscles. It does not go out into the bloodstream to keep our blood sugars up. So the glucagon that's produced is going to produce and especially if you're not doing lots of physical activity and burning that sugar down, there shouldn't be a whole lot of need for a lot of glucagon. So I imagine there's a baseline level of it, but you shouldn't get big surges of that as you do when we're eating a standard diet there.
So is black decaf coffee okay?
When fasting.
Coffee lovers.
During fasting? Black coffee during fasting. You don't want to drink black coffee while you're fasting. It's not the caffeine, it's the coffee oils that make coffee. It's that black thick stuff at the bottom of the cup there. You don't want that sloshing around your stomach line. The stomach is sensitive enough during fasting. Don't put black coffee down there. You'll be you're going to wind up with a very sour stomach, and maybe and a lot of folks are on the verge of nausea to begin with. Put some black coffee down there. I think you're going to be pretty unhappy. Don't drink black coffee during a fast. Yeah.
Wonderful. Dr. Klaper, that's we have come to the end of questions, and it's just been so amazing to have this chat with you, and you taking time to answer all these questions for us. And we know how busy you are. You're teaching people all over the world. For our viewers, Dr. Klaper is available and plant-based telehealth is available for online consultations. Like, you can consult with him right from your living room. So what a treat.
Go to my YouTube channel, Dr. Klaper, on YouTube, and I'm on Instagram at Dr. Klaper. And I post 3 videos a week, short little videos on Q&A stuff. Send in your questions to my YouTube channel, my Instagram channel, and we'll answer your question as well. And I want to thank you for the beautiful work you do, for the example you set as human beings, as healthy man and woman eating a plant-based diet, but as physicians, you're just exemplary. The word doctor comes from the same Greek root as doctrine, as teachers. We're teachers, basically. And you're doing such a magnificent job. You're healing so many people through your teaching and the example you set. You are exemplary physicians. You are a credit to our profession. It's an honor to work with you in any capacity. And I thank you for the opportunity to share this time with you and your viewers, and encourage you to keep up the great work, and consider me an ally as well as a friend. Call on me anytime if there's anything I can do to help forward your one noble efforts. It'd be my honor to do so. So thank you, and blessings to all your viewers of health and happiness. Stay happy.
Thank you.
Thank you so much for that heart. Thank you so much, Dr. Klaper. It has been an honor.
Truly, namaste, really.